It's excruciatingly painful. Swelling is a common symptom. It's rapid onset, so the day before you could feel fine. The following day, the toe could be so painful you can't even walk on it. Hello, my name is Dr. Ziad Farah. I'm a consultant rheumatologist and general internal physician. Today I'm going to talk to you about gout. This is a condition that I see very commonly in clinic. So what is gout? Gout is a condition that causes inflammatory arthritis. It is caused by the accumulation of uric acid, which is a normal salt that is dissolved in most of our body fluids. But if you have too much of it in the system, then that can cause severe inflammation in the joints, and that presents as gout. So what does gout normally affect? You may have heard this from experience or from relatives or otherwise, that the big toe is the most common site for gout to present with an acute episode. Now, this can feel really, really painful. It's excruciatingly painful. Swelling is a common symptom. It's rapid onset, so the day before you could feel fine. The following day, the toe could be so painful you can't even walk on it. The causes of gout, there are many causes. There are some which are not modifiable. What I mean by that is that's to do with your genetics. Some people are born with a certain metabolism. That means that your body produces too much uric acid. Other things are lifestyle factors that contribute. For example, diet is a big contributor to development of gout. Some foods are very rich in purines, which lead to high uric acid. For example, red meat, shellfish are key examples of foods that can push up the uric acid level. Alcohol can also lead to increased uric acid. And certain medications are also implicated in that. For example, some patients require water tablets for heart failure or TB medication for infection, and these things can increase uric acid levels. So how do we diagnose gout? Well, the diagnosis is mostly through a clinical history. Like I said, this is a sudden onset, rapid, severe, debilitating pain that causes significant swelling in typical joints. A set of blood tests, for example, and these blood tests would include things to check the inflammatory markers, things to check the level of uric acid. Sometimes, if a joint has a lot of fluid in it, I may take a sample from the joint, such as the knee, for example, and that fluid is sent to the lab for analysis, and it would show typical uric acid crystals in the joint fluid. Imaging has a role, but less so. For example, an MRI or an ultrasound can be used, but this will only show inflammation and would not distinguish between gout and other inflammatory arthritis conditions. So how do we treat it? Well, there's two things to think about here. The first is, how do we manage the acute inflammatory episode? So during acute inflammation, management is targeting inflammation with medication to bring down that inflammatory response. And this is with things like anti-inflammatories, ibuprofen, for example. Another drug is called colchicine, which works very well for gout. And if things are not getting better with those kinds of medication, then I quickly escalate to steroids. This can be by tablet steroids or injection steroids into the affected joint. These are all things during the acute episode. But thinking about the long term, how do we prevent the episodes from happening in the first place? How do we prevent this from becoming a recurring problem? And that is to do with looking at the uric acid. I mentioned a few things that are in the lifestyle, modifiable risk factors. Those are the first thing we need to address. For example, reducing alcohol intake, adjusting the diet, rationalizing medication that may be implicated. But then also, sometimes, even with all those things in place, the uric acid remains high. And so I usually prescribe a medication to lower the uric acid. A drug such as allopurinol or febuxostat are examples. And we would then measure the uric acid levels on regular intervals. And then we try to get it to below a certain target, because we know once the uric acid in the blood is below that level, the episodes will not happen again. Now, the important thing to mention is that this is a process, and different patients have different doses that they need. And the blood tests, it takes a while for that to show a difference. So I usually repeat the blood test every 4 to 6 weeks before I make a dose adjustment. And once we reach the target, then hopefully no more episodes will happen at that stage.